Welcome back to BNC Live. I'm Tishani Whitlow. Millions of Americans and businesses jumped for joy over the new guidance from the CDC about wearing masks indoors if you're fully vaccinated, but there was very fine print. Right now, I have the honor of welcoming Dr. Anthony Fauci to BNC Live. Now, he needs no introduction unless you've been living under a rock for the past 14 months. He's the director of the U.S. National Institute of Allergy and Infectious Diseases. He's also the chief medical advisor to President Biden. Again, Dr. Fauci, welcome to BNC Live.
Good to be with you. Thank you for having me.
Now, Dr. Fauci, earlier this week, you and other CDC officials were grilled on Capitol Hill about conflicting messages regarding mask wearing. Was this move to lift the mask mandate political?
No, it was not. Actually, it was really based on the evolving information, scientific information, that was accumulating over the previous several weeks to months, where it became very, very clear that when you look at the number of infections per day, the 7-day weekly average on a daily basis, it had gone down about 1/3 over a period of a few weeks. And importantly, as the real-time, real-world data on the effectiveness of the vaccine, it became clear that we were dealing with a vaccine whose effectiveness was even better than what we saw in the clinical trials. So that the protection against infection, the protection against severe disease was so impressive that it was felt that if you were vaccinated, we could start taking those next steps towards normality. And that next step would be to get people to essentially be mask-free, with very unusual circumstances where they'd have to wear a mask. And that's the reason why the guidance was changed, so that not only do you not need to wear a mask outdoors, but you don't need to wear a mask indoors. So it was really based on science.
Let's talk about the J&J vaccine. Now, we know in the beginning it was marketed heavily to Black and brown communities as a one-and-done deal, but it was recalled because of rare blood clots, and now we're also hearing about an outbreak among vaccinated Yankees players. Dr. Fauci, do you still stand by J&J's one shot?
Yeah, I do. I mean, if you look at the overall data, that it's really quite an effective and really safe vaccine. Despite the fact that there were some issues there about blood clots, when you go and look at all of the data, the incidence of that was vanishingly small. The issue with the Yankee baseball organization was, again, if you look at those people who did get infected, they had essentially 5 out of 6 of them had no symptoms at all. But if you look at the total number of people that are vaccinated and the breakthrough infections, they, again, are a very rare event. So the answer to your question, the specific answer, that we still stand by the high degree of efficacy and safety of the J&J.
And what's being done to make sure that rural and minority communities have access to the vaccine, which has been an issue from the start of this vaccine rollout?
Yeah, a very important part of the rollout program has been the issue of equity. And President Biden himself has made it very clear that has to be built into every aspect of the rollout and distribution. And a number of things have taken place. For example, the distribution in community vaccine centers that are located also strategically in areas that are demographically highly representative of minority populations, particularly African Americans and Hispanics. Also 40,000 pharmacies, many of which, again, are located geographically so that they're convenient to people of minority issues, for example, Latino communities, African American communities. We also have mobile units that go out in poorly accessible geographic areas for people who cannot conveniently come to a place to get vaccinated. All of these things are going on as an integral part of the vaccine rollout program, and all of it is overseen by an equity task force that we have representatives in the White House itself, but also even outside consultants who are just devoted to the concept of equity.
And Dr. Fauci, for people like myself who are vaccinated, how long will our vaccines last, and will we need booster shots?
It is very likely that sometime in the future you'll need a booster. We don't know when that will be. We know that the duration of the protection is at least 6 months and likely considerably longer. We're following people from the clinical trials to determine when you get to the point where the level of the protection that is at high level and it gets below a critical point below which you're in danger of, if you get exposed, getting infected, at that point, it'll be clear that we will need to give boosters. So, but in direct answer to your question, I believe that we will have to get a booster sometime. I'm not sure whether it's going to be at the end of a year or 18 months, but I'm fairly sure we'll have to get boosted.
And do you know when that information will be released, Dr. Fauci?
Yeah, I would think probably as we get into the fall, late fall, early winter, we'll know exactly when it'll be, whether it will be this winter or as we get into the spring. We'll see.
Got it. Now, our next question is from a Twitter user, Jason Wu. He wanted us to ask you if evictions are a public health issue and whether you were advising the CDC to strengthen the federal eviction moratorium. Dr. Fauci?
You know, I have not discussed the eviction situation with them, to be honest with you. That has not come up in my interactions. Most of what I do, as you know, is involved in countermeasures such as vaccines and therapeutics and public health policy. But the issue of the federal eviction moratorium, I have not discussed.
If you were asked, what would you say about it?
Well, you know, when you're dealing in times of crisis, I think the idea about evicting people is something that you really need to put on hold because of the difficulties associated with that. You don't want to make a very difficult situation worse. And one of the ways of making it worse would be to have people getting evicted from their homes.
In the middle of a pandemic, which could also create a surge, especially for those folks who are unvaccinated. Now, the next question is from Randy Wayne Garten. He's the president of a key teachers union. He says schools must be full open in the fall. He also wants to know, some doctors say that mask mandates go away. Infections in children will increase. Now, at the start of the pandemic, there was data that showed that children weren't high risk for severe COVID-19 symptoms. But as variants spread, do we really want to take the risk with our children? That's what she wants to know.
Okay, so first of all, in answer to the question, I agree with Randy completely. We're going to get the kids back to school in the fall term. That's for sure. We really have to do that. We know what the deleterious effects of keeping kids out of school in the sense of presence in the classroom is really very important. The other thing is that, yes, although children do not generally have at all a high level of serious disease when they get infected, they still can, in fact, get infected and get sick. We've seen that. They're not completely immune to that. However, they also can be part of the spread of the dynamics of the outbreak. So that's the reason why, ultimately, when vaccines are available, you want to have children vaccinated. Until that point, they should be wearing masks.
And speaking of children, what advice do you have for unvaccinated people, including children with compromised immune systems and health issues such as asthma, who can't wear a mask?
Yeah, I would say please get vaccinated if you're old enough. If you're 12 years old or older, please get vaccinated. If you're not, wear a mask if that's possible. If that's not possible, then you're going to have to try and get to a point where you can protect yourself from exposure to people who might be infected.
And okay, what about people if you're in a crowded place and you are unvaccinated, you're with unvaccinated people who are not wearing a mask? Would you be protected, even if you are vaccinated, by wearing a mask?
If you're not vaccinated, masks cut down dramatically the likelihood that you're going to get infected. The best way to do that is to get vaccinated, because that is an overwhelmingly good way to prevent infection, and if you do get infected, to prevent serious disease.
And the next question for you is from another social media request. John Reed IV, he says, please ask about the impact of vaccines and pregnancies. What advice do you have for pregnant women in being vaccinated, Dr. Fauci?
Well, we have a lot of experience now of women who got vaccinated during pregnancy, literally tens and tens and tens of thousands of women. And there is no indication at all that there's an issue there. We have not formally done a trial in women, but if you look at the data that's accumulated despite a clinical trial, there doesn't seem to be any red flags. The one thing you want to make women understand, and they do, and that's the reason why they're getting vaccinated, is that the effect of COVID-19 disease on pregnancy, both on the health of the pregnant women and on the health of the pregnancy itself and the baby, that is deleterious consequences for both the mother and the child. So you don't want to get infected with COVID-19 when you're pregnant. That's the reason why so many pregnant women are opting to get vaccinated.
And Dr. Fauci, I believe this is going to be my last question because you have been a great soldier and we appreciate your time here. A recent New York Times article revealed 80% of epidemiologists surveyed in the last 2 weeks believed that Americans will be wearing masks in public indoor places for at least another year, while 5% of people said, or epidemiologists better yet, said that masks would no longer be worn. What are your thoughts?
Well, my thoughts are proven by what's happened over the last couple of days. We've had the CDC say when you're vaccinated, you don't need to wear a mask indoors. So that question that was put in the New York Times has actually been settled by the actual guideline itself.
Got it. Dr. Anthony Fauci, it was such an honor having you on BNC, sir. We appreciate everything you've done and how you've been a voice of reason during these crazy times. Thank you and have a great weekend, sir.
Thank you so much. It's good to be with you. Thank you for having me.